Hi, my name is Meghan Willoughby, and I'm a third-year medical student at IU School of Medicine. Last summer, I worked at RHI with Dr. Littell, and my presentation for Care Week is called The Effect of Acute Inpatient Rehabilitation on Functional Outcomes and Discharge Disposition Following Liver Transplant. So when starting this project, we felt that there was a need to provide further research on the impact that acute rehabilitation can have on patients post-liver transplant. After conducting a literature review, we found that there was a scarcity of data evaluating how acute rehabilitation does impact functional measures and favorable discharge dispositions in these patients. The rates of liver transplantation has also steadily increased over the years, as you can see in this chart here. This is due to growing recipient pool, expanded considerations and criteria indicating liver transplantation, and increased availability of deceased donors. For some considerations for liver transplantations, patients must have irreversible liver disease and sufficient likelihood of both surviving the procedure and benefiting from the transplant. Due to the often chronic nature of the conditions that would allow patients to be considered for a liver transplant, patients can experience reduced functional independence, malnourishment, muscle fatigue, muscle wasting, fatigue, and weakness following transplant. And therefore, acute rehabilitation that is focused on improving patients' quality of life and functional independence can serve as a fundamental component of their postoperative care. So in starting this project, we did a literature review. The main study that we did find that was similar was by Cortazzo et al., who in 2005 conducted a chart review of 55 patients evaluating some of the similar variables that we wanted to evaluate in our study. So we aimed to expand the data of the Cortazzo study. Specifically, we wanted to evaluate the effect of acute rehabilitation on patients who received acute liver transplantation and to evaluate how effective acute rehabilitation is regarding readmission rates to acute care. So for methodology, this was a retrospective cohort study, and the variables here were compiled, so including the duration of stay, the admission and discharge FIM scores, the discharge disposition, so where the patient was discharged to, and the reason of return to acute care or RTEP. And these were the calculations that we looked at, so both FIM change and FIM efficiency. And all the data was stored in a REDCap database and de-identified. So here was our inclusion criteria. So the patient must have received a liver transplant between 2014 and 2018. They must have been admitted to RHI within 6 months following the transplant, and all the necessary data, so this data here, was included in their chart. So this is a functional independence measure or FIM instrument, and this is what we took advantage of in our study. So as you can see, there are 18 items in the categories of self-care, sphincter control, transfers, locomotion, communication, and social cognition, with the top being motor categories and the bottom being cognitive categories. And each item is given a score of 1 to 7, with 1 being total assistance required and 7 representing complete independence. So patients receive a FIM score upon admission and also at the time of discharge, and then we can use this to calculate the FIM change. So for our statistical analysis, our sample size was 143 encounters consisting of 107 patients. So these two numbers aren't the same due to the fact that we did have some patients that had an interrupted stay at rehabilitation, where they had to return to acute care due to complications and then return back to rehabilitation. So that would be one patient that would count as one patient, but count as 2 different encounters. So for this study, we evaluated the mean, median, and standard deviation for these following categories. And for statistical tests, we use one sample t-test with a significant level set at alpha less than 0.05 and simple linear regression. And then just due to the nature of our study, we did not need to randomize or blind the data. So for the demographics of our study, the sample size was 107 patients meeting our inclusion criteria, and the mean age was around 62 years old, and there was around 73% male. So as you can see in this chart, it's broken down into all encounters and also when we removed the encounters where the patient had to return to acute care due to complications. And then the changes listed at the top were evaluated for both of these categories. So this was to basically include the data, evaluate the effects of rehabilitation with and without the confounding variables of the complications that return to acute care. So for some context on the FIM score here, patients seem to have a mean admission FIM score of around 60, which means that they benefited from moderate assistance in all levels. For their discharge FIM score, this was around 90, which means that they did not need physical assistance, but may benefit from some assistance in setting up tasks and benefit from some cues. Specifically for the mean FIM change, with all encounters, you can see it was around 25. When we removed the return to acute care encounters, this was around 35. So this does show that the return to acute care encounters did negatively influence the trends of the efficiency of the rehabilitation. So as you can see here, we conducted a linear regression on the variables for FIM change and duration of stay. On the left, this is for all encounters. On the right, this is for when we excluded the RTAC encounters. As you can see for both of these graphs, due to the p-value being far below the significance level, this does confirm the significance of the R values. The R values show that there is a low to moderate positive correlation between the two variables, indicating that a longer duration of stay in acute rehabilitation may allow a patient to achieve a more positive FIM change. So here we discuss the discharge dispositions of both encounters and patients. So as you can see, most notably, 62% of encounters were discharged to the community at their first discharge, which is comparable to the national average listed here, which we found in an article published by the JAMA Network in 2018. Also looking at the patient discharges, you can see that 83% of patients were ultimately discharged to the community, which is similar to the study by Cortazzo. In the chart, you'll see the reasons for return to acute care, with infection being the highest, followed by respiratory CV and gastrointestinal complications. So for contributions to evidence-based practice, we found that liver transplants do severely impact patients' functional independence, which does show the need for rehabilitation, especially as the rate of transplantation is increasing. Acute rehabilitation does allow patients to significantly improve their functional independence after they received a liver transplant. Patients may benefit from longer lengths of stay in acute rehabilitation, and this may allow them to increase their FIM gains. Also, minimizing patients' return to acute care can increase their effectiveness of their rehabilitation and their gains. So for acknowledgements, I really want to thank Dr. Littell and RHI for making this project possible. And then here are my references. Thank you very much.